Jason says, it appears to me that the grading system for ACOs is primarily based on their reporting rather than the actual health outcomes of their patients.
Yes, thanks, Kyle, and thanks, Jason. I'll point out that all of today's questions came from Jason. I think he's pursuing a master's level understanding in ACOs and quality reporting. You've made an astute observation, Jason. You're cutting right to the core of the complexity and confusion that is quality measurement. I'd argue with your characterization, ACO quality measurement primarily measures an organization's reporting aptitude. I think they're both in there, real quality and the aptitude. I think you may be spot on for early, immature, and undeveloped measurement systems. But with time, development, and practice, the actual quality of the outcomes eventually shines through. I'm not aware of any measurement system that purely measures what it intends to measure. The first hurdle to cross in any measurement system is to develop and implement an effective measurement tool or system. Until that system is uniformly effective, the comparison of measures typically first compares the effectiveness of the system, and then later, as you refine that system and get good at it, it more thoroughly measures and compares the actual outcome. So of necessity, before they can effectively measure the targeted health outcomes, they have to measure a cascade of factors that have to exist before the desired health outcome is the primary output. Well, I wonder if I lost you somewhere in that chain. To try to make this simple, there are 10 factors, I think, that collectively make a good health outcome measurement. Only 2 of those 10 factors actually represent great care, but failure of any one of them or combination will result in a bad score. So the first 2 factors are to recognize and document eligibility of the patient for the care. The second 2 are to provide and to document the provision of that care. That's actually a care-related piece of this. Next, for 5 and 6, measure and document the results or the outcome. You can provide great care, but if you're not actually measuring the results, aware of the outcome, it's hard to report on your outcomes. Then it's to identify the denominators. So you have to be able, if you've recorded, documented it well, and you have a good identification system or measurement system, you need to then identify the denominators, that is the patients or visits that are eligible for measure. Then you identify or recover the outcome, the numerator status, and patients representing, that is the patients representing successful performance. And then calculate the performance measure, that's 9, and 10, report the metrics to those interested in it, in this case, a CMS. In any one system, improvements in qualities filter through to the results, but the absolute value of the results and the cross-organizational comparisons still reflect a fair amount of the differences in all of the other measurement and reporting effectiveness measures. So it really is a complex system. You can fail on the system itself or the measurement itself, but as you get better at that, then your comparisons are going to be on true performance. So it takes some work, takes some time, takes some practice, takes repetition, takes a little bit of knowledge and devotion to get this all working well. Thanks, Jason.